Erin Huckabee, and I'm a marriage and family therapist associate, and I work at Robocheck and Thacker Counseling. In our last video, we talked about how do I actually find a therapist, and in this video, we're going to talk about what's therapy actually like. A lot of people, we just don't really talk about it, so it's a great question. If you've never been to a mental health professional before, it can sometimes seem scary or just downright weird to talk to a person that you don't know about your life. And that is weird. So in your first session, it's usually called an intake or an assessment. And there you will talk about informed consent, or you are informed about consent for treatment. You talk about confidentiality, and then the therapist spends a lot of time asking you questions, or you can just talk about whatever it is that you are coming in to talk about. So sometimes it's just really a lot of gathering information. That's really what it is. And then any subsequent sessions that you set up after that are going to be about you and just really whatever you want to bring in. Usually in the first session you set some goals, and so in subsequent sessions, the second, third, fourth session are usually pretty client driven. So it's in the first session you're talking about whatever goals you have for therapy, and in the sessions after that you're talking a lot about how to actually go about fixing those things or goals or processing whatever it is that you want to do. And so you do that by problem solving, learning coping strategies. You process through your emotions or situational emotional reactions that you have in certain things. Typically therapists are not advice givers, but we give feedback on what we hear in session and kind of what's going on. And so we're not going to give you advice or what to do, but it's just more like helping you get to where you want to be with you doing that. I'm a little biased because I think therapy is awesome. It's really nice having an unbiased third party to talk about your life to. Therapists are definitely people. They're not robots. They're trained to kind of remain unbiased. So we're still going to have normal human reactions to things, but it's usually pretty easy to talk to a therapist. So if you're interested in knowing how therapy is and what happens when it's over, or how do we figure out when am I supposed to be done with therapy, tune in next time for our next video and we will talk about that. Thanks for watching.